All right. On behalf of Flagler Cares and One Voice for Volusia, welcome to the 2021 Health and Human Services Summit. My name is Dale Schuberg, and I will be the moderator of this session. You have joined the session titled Breaking the Barriers of Stigma. All participants will be muted during the session. There will be a Q&A time at the end of this session for you to pose questions. You may raise your hand using the reactions button at the bottom of your screen. We will then call on you and allow you to unmute yourself. You may also submit questions during the training in the chat box, and we will pose them at the end of the session if time allows. Thank you to the sponsors who made this event possible: Advent Health, Career Source Flagler Volusia, SMA Healthcare, Magellan Complete Care, Department of Children and Families, and the House Next Door. It is my pleasure to introduce your trainer for this session, Karen Chrapek. Is that correct?
Chrapek.
Chrapek.
Hard name, don't worry.
Thank you.
So, hello, everybody. Good afternoon. I'm Karen Chrapek. I am a person in long-term recovery. And this subject is very dear to my heart because I've been impacted by stigma in my own personal story. So today's objectives are to cover some aspects of substance use disorder, address stigma as a barrier to recovery, and including internal and external stigma, and talk about recovery resources locally. So why is this an important topic? Next slide, please. Because there's a very high cost of substance misuse. Illicit drug users are likely to miss 2 or more days of work in the past month, and to have worked for 3 or more employers in the past year. Drugs in the workplace are issues that organizations cannot ignore. More than 75% of individuals with substance use disorders continue to maintain their employment, but the workforce impact often goes undetected, with the ill effects of it attributed to other factors. Approximately 50 to 80%, you can go to the next slide, 50 to 80% of all child abuse and neglect cases are substantiated by child protective services were because of the parents' substance use. Every 25 minutes, an American baby is born addicted to opioids. Parental exposure to alcohol, tobacco, and illicit drugs have the potential to cause a wide spectrum of physical and developmental challenges for these babies that really continue for their entire life in many cases. Studies show that 1 in 5 people experiencing homelessness are homeless because of their substance use disorder. And then the crime, 60% of adults in federal prison are there for drug-related crimes. Next slide. So there's a huge consequence of substance misuse. Fatal overdoses hit a record high last year. Over 81,000 drug overdoses occurred in the United States in the 12 months ending in May of 2020, the height of COVID. This is the highest number of overdoses death ever recorded in a 12-month period, according to the CDC. Volusia County is similarly impacted with 49 overdose deaths this year from January 1st through May 30th, and it continue to rise. Overdoses are now the leading cause of injury death. Other consequences include incarceration, potential child abuse and neglect, loss of employment, increased treatment admissions, and increased emergency room visits. Next slide. So what is substance use disorder? The American Society of Addiction Medicine, which tells you, hey, it's a disease, because there is such a thing, released a new definition of substance use disorder. At its core, substance use disorder isn't a social problem, a moral problem, or a criminal problem. It's a brain problem whose behaviors manifest in these other areas. That was said by Dr. Miller, past president of ASAM. Research shows that substance use disorder affects the brain's reward circuitry such that memories of previous experiences with food, sex, alcohol, and other drugs trigger cravings and more addictive behaviors. The brain circuitry governing impulse control and judgment is also altered in the brains of those with substance use disorder, resulting in the nonsensical pursuit of rewards such as alcohol and other drugs. Next slide. It explains why people continue to come back to the emergency room in an overdose because of what's going on in the brain. Substance use disorder is a chronic relapsing brain disease characterized by compulsive drug seeking and use despite harmful consequences. It's a brain disease because brains actually change, the drugs actually change the brain. They change its structure and how it works. These brain changes can be very long lasting and can lead to many harmful and self-destructive behaviors. Nearly all addictive drugs directly or indirectly target the brain's reward system by flooding it with dopamine. Some drugs cause a bigger rush than others. Stimulants tend to cause a huge amount of a rush of dopamine. Dopamine is the neurotransmitter present in regions of the brain that regulate movement, emotion, cognition, motivation, and feelings of pleasure. The overstimulation of this system, which rewards our natural behaviors such as breathing, eating, procreating, produces euphoric effects sought by people who use drugs and then teaches them to repeat the behavior over and over again. Next slide. The disease is characterized in 5 ways. First is compulsive use. Second is loss of control. Third is the continued use despite consequences. And sometimes those consequences are really, really horrendous. Tolerance. Tolerance means that 2 pills today, you will need 6 pills several months down the road to get the same effect. And then withdrawal. If you take away the drug or the behavior, the person will go through either emotional, physical, or mental anguish. Next slide. So on the left-hand side of this slide, that purple line going that ends in the prefrontal cortex is the reward pathway. It's within the reward pathway, which is basically in the center of your brain where your memory banks are, is where the dopamine flood happens and where the disease of substance use disorder really lies. On the right-hand side is the control brain. Those areas of red are areas of brain activity. When you introduce cocaine, you'll see that those areas are diminished. Again, showing, physically that this is a brain disease and what the effect of drugs actually happens in the brain. It can take some time to heal the brain, but eventually some of those activity portions of the brain will come back. Next slide. So it is a chronic relapsing disease like many other diseases, such as diabetes, such as hypertension, and such as asthma. And I wanted to show this slide because everybody gets so frustrated with people with the disease of substance use disorder. However, as you can see by the slide, with hypertension and asthma, the propensity for relapse is even higher than with the disease of substance use disorder. Next slide. So the likelihood of sustaining recovery another year grows after time. So we know that the opposite of substance use disorder is connection. And so as people get plugged into the recovery community, as they get plugged into their pathways of recovery, the brain's going to heal and the person is going to be less likely to return to use. So only 1/3 of people with 1 to 12 months of recovery will sustain that for another year. Hence, it's so important to help them connect to the recovery community. After 1 to 2 years of recovery, 2/3 will make it another year. After 4 years of recovery, about 86% will make it another year. And then, after 7 years of recovery, only about 14% will relapse every year. So this slide shows that the longer you can stay away from, you can move on to the next slide. The longer you can stay away from a drug or active pursuit of your substance use, the longer, the more likely you are to stay in recovery. So what does recovery look like on average? In the first 12 months, you're going to see more recovering friends, less illegal activity and incarceration, less homelessness, violence, and less use of by others at home and work, and less use of drugs by social peers. From 1 to 3 years, there's a virtual elimination of illegal activity and illegal income, better housing and living situations, and increasing employment and income. And then from 4 to 6 years and beyond, you're going to see more social and spiritual support, better mental health, housing and living situations greatly improved, dramatic rise in employment and income, and dramatic drop in people living below the poverty line. Next slide. So stigma. Stigma is a mark of disgrace, infamy, a stain or reproach as on one's reputation. Why is this important? Because stigma really does kill. So stigma is a set of negative beliefs that a group or society holds about a topic or group of people. According to the World Health Organization, stigma is the major cause of discrimination and inclusion, contributing to an abuse of human rights. When a person experiences stigma, they are seen as less than or perceived of a real or perceived health status. Stigma is rarely based on facts, but rather on assumptions, preconceptions, and generalizations, bias and prejudice. Stigma results in prejudice, avoidance and rejection, and discrimination against people who have a socially undesirable trait or engage in culturally marginalized behaviors, such as drug use. Family, friends, and the general public carry negative feelings about drug use or behavior. They may even use derogatory terms such as junkie, alcoholic, or crackhead. I myself have called myself, I was a cocaine user, and so sometimes I jokingly call myself a coconut, but it's really a derogatory term, right? So we can perpetuate our own stigma. These feelings, thoughts, and labels can create and perpetuate stigma. Next slide. So stigma has the potential to negatively affect a person's self-esteem, damage their relationships with loved ones, and prevent those suffering from substance use disorder from accessing treatment. Stigma is a public health issue. It leads to high rates of death, incarceration, and mental health concerns among dependent populations. Stigma can be divided into two types. One is social stigma, which is characterized by prejudice and discrimination directed towards individuals with mental health and substance use problems. It really carries a lot of shame with it. The fear of judgment happens, and overall, it's very detrimental to a person's psyche. Internal stigma is the internalization by the sufferer of their perceptions of discrimination. Perceived stigma can lead to feelings of shame and poor treatment outcomes. Shame and guilt with people with substance use disorder really kills. And I'm going to tell a little bit of my own stigma story. So I was a candidate for recovery at the age of 20. I was already a respiratory therapist, and I was already well regarded in my field. And so I knew that my drug use was starting to really negatively affect my life. But I was too ashamed to ask for help. I was so afraid that somebody was going to judge me, or I was going to lose my job, or I was going to be made fun of, that I never asked for help for 10 years. In those 10 years, my life spiraled out of control. I destroyed my dream was to be a doctor. And because of stigma and because of my substance use disorder, I did not pursue medical school and I never became a doctor. I also had a dream about being an artist, and recovery has given me that. Today I am an artist, but that's an aside. So anyways, the prevalence of substance use stigma. We live in a society where millions of Americans are dependent on alcohol and drugs, and only a very small percentage receive treatment. A national survey on drug use and health found that 19.7 million Americans aged 12 and over battled a substance use disorder. Stigma affects us all, and nearly everyone has either felt stigmatized or has stigmatized others at some point in their life. A study done by Johns Hopkins Bloomberg School of Public Health showed that the general public was more likely to have negative attitudes towards those dealing with drug misuse than those dealing with mental illness. Additionally, researchers have found that people generally don't support insurance, housing, and employment policies that benefited people who were dependent on drugs. And this, again, is a barrier to recovery. Those things, when they're impacted and people in recovery can't access housing and can't access good employment, they're more likely to return to use. An aside that I want to bring up at this point is the Volusia Recovery Alliance does have a contract with the Flagler, with Career Source Flagler and Volusia to present a project called Career Connect, where we help people in recovery connect to a new career path. We're really proud to be involved in that with the Career Source here. So how does stigma hurt? Well, it impacts negatively in a number of areas, including the willingness to attend treatment or to access healthcare, harm reduction, and self-esteem and mental health. The impact on treatment is that, unfortunately, stigmatized people's unwillingness to seek treatment results in higher economic, social, and medical costs. Also, criminal justice costs. In the United States, costs associated with untreated substance use disorder, including those related to healthcare, criminal justice, and lost productivity, amounted to a whopping $740 billion. It's a huge amount of money. Next slide. So how stigma also hurts. Stigmatization of people with substance use disorders may be even more problematic in the current COVID-19 crisis. In addition to their greater risk through homelessness and drug use itself, the legitimate fear around COVID-19 may mean that bystanders or even first responders will be reluctant to administer naloxone, Narcan, to people who have overdosed. There is a danger that overtaxed hospitals will preferentially pass over those with obvious drug problems when making difficult decisions about where to direct life-saving personnel and resources. And we know that COVID-19 has definitely increased the amount of overdoses in our community for a variety of reasons. So the picture of stigma, becoming dependent on drugs can literally happen to anyone. All it takes is an accident, and you could become addicted to opioids. It is important to keep in mind that we can all do a better job of decreasing stigma around drug use. A Recovery Brands survey had respondents provide written reflections about what they wished people or society at large understood about substance use disorder. Their responses help illustrate the importance of remaining kind, compassionate, and human. This image includes some quotes from some of the respondents. So just because I am or was an addict doesn't make me a bad person. Deep down inside, we are wonderful, loving people who are really usually very smart and creative. It's not a matter of willpower or lack of moral compass. Addiction is not the entirety of me. I am me. I am not just my addiction. There's a lot of other stuff to love. And I wish people saw the time that addicts spent alone, thinking about everything they've done, every time they've lied and stole. And this is one of the things that can lead to severe guilt and shame and really be a barrier for recovery. So some effective ways to help reduce stigma include offering compassionate support, displaying kindness to people in vulnerable situations, listen while withholding judgment, see a person for who they are, not the drugs that they use, do your research and get educated, treat people with drug dependency with dignity and respect, avoid hurtful labels, reduce negative attitudes with evidence-based facts, speak up when you see someone mistreated because of their drug use, and share your own stories of stigma and recovery. Next slide. So this is a snapshot of my recovery life. I like to say, let's start a recovery epidemic. Recovery is possible, and you too can recover if you want to recover. So I'm a wife, I'm an employee, I was my mom's caregiver, I'm an artist, I'm a friend. The two ladies on the upper right are two of my mentors that have helped me along the way in my recovery. In the center photo is a picture with the Deputy Surgeon General from the Obama administration, Admiral Trent Adams, who I got to spend an afternoon with our clients at the Darryl Strawberry Recovery Center. And she had such a deep understanding of the disease of substance use disorder that it really made a difference to our clients, especially our veterans who struggle with stigma and shame and guilt. And it was really a very helpful session. Next slide. So language really matters. And it's important to use person-centered language. So instead of saying, a person's an addict or a druggie, say a person with substance use disorder. For instance, saying that instead of saying somebody relapsed, we can say return to use. Instead of saying someone has a dirty urine, we can say that they have a positive drug screen. So, there's ways to really move beyond the stigmatizing language. I try not to use the word addiction anymore because people's perception of an addict is the person under the bridge that is, completely strung out on drugs. Some things that you shouldn't say: don't tell the person they're selfish. Why don't you just stop? It's a brain disease. They are having trouble stopping. I give up. You'll never beat this addiction. You're doing it all wrong. Recovery has to be done this way. There are multiple pathways of recovery, and there's not just one way to recover. What you can say instead is you change, and then give concrete examples. Give actual specific scenarios where you've seen the person doing something that they would not ordinarily do. Tell them, I love you, I care about you. You're not alone. Everybody needs help. Every human being at some point in their life is going to need help. It's not your fault, it's a brain disease. Things will and can get better. And then how can I help? I try to ask people today, how can I help you in recovery? Next slide. This is a series of questions which I sometimes give out as a handout. It's to help have a dialogue by asking questions to help the person determine whether or not they have substance use disorder. So a couple of questions. Do you think about drugs and alcohol a lot? Do you ever use drugs or alcohol because you're upset or angry at other people? Or have you been arrested or in the hospital because of your drug or alcohol use? Have you ever overdosed? So next slide. Those are some things you can ask to start kind of helping the person break through denial, which is also a symptom of the disease. So what can you do? Have a strong drug-free workplace policy. Do pre-employment drug screens. Do random drug screens. Do post-accident drug screens. Encourage company-wide honest and open communication. Having an open door policy is really helpful. Offer an employee assistance program. You can do the Marchman Act, which is basically similar to the Mental Health Baker Act. It's for people with substance use disorder. If they're at risk of hurting themselves or others, it's court-committed treatment. And then learn about various treatment options. Next slide. So regardless of the level of care, holistic treatment ensures that all needs contributing to a person's substance use is addressed. For example, a well-developed treatment plan addresses the person's biological, psychological, spiritual, and social needs in one comprehensive approach. Engaging in the 12-step self-help community is encouraged as well. These days, multiple pathways are more readily available, embraced and promoted by local recovery community organizations. A quote that I really like is, when the I is replaced with we, even illness becomes wellness. And that was said by Malcolm X. Next slide. So the recovery movement in Florida is growing. We actually have a statewide recovery community organization known as Floridians for Recovery, which is bringing together the voices of recovery so that people know that a life of wellness from substance use disorder is possible. What is a recovery community organization? A recovery community organization, or as we say, an RCO, is an independent nonprofit organization led and governed by representatives of the local recovery community. These organizations organize recovery-focused policy advocacy activities, one of which we're currently involved in by trying to change background checks for peers and other people that want to work in the field of addiction medicine. We carry out recovery-focused community education and outreach programs, and/or we provide peer-based recovery support services. For more information in general for the state, you can go to floridiansforrecovery.org. Next slide. So this is a map of RCOs in the state of Florida, some of which were basically spawned from a grant from the Aetna Foundation, which provided the Florida Alcohol and Drug Abuse Association with grant money to help establish recovery community organizations throughout the Florida. And you have two right here in Flagler and Volusia. One is Flagler Oars and the other one is the Volusia Recovery Alliance. Next slide. So what is the Volusia Recovery Alliance? We are the recognized leader for recovery resources. We are a grassroots, not-for-profit education and advocacy recovery community organization, committed to furthering the message that recovery is possible for anyone who desires a life of wellness. Our purpose is to coordinate peer-driven services that provide substance use recovery resources. Our mission is that we exist to serve all those seeking recovery from the impact of addiction, including family, friends, and allies. Our vision is that we're working to mobilize resources, reduce barriers, increase awareness and support in an effort to eliminate stigma and enhance recovery through multiple pathways. We link those persons with substance use disorder, their loved ones and allies, to the resources that help sustain recovery. Next slide. VRA is a strong, committed, and diverse network of allies and individuals in recovery who are actively engaged in efforts to eliminate the stigma of substance use disorder, build a vibrant recovery-ready community, represent the voice of recovery and those individuals impacted by addiction, promote harm reduction via our New Chance Narcan Outreach Committee, serve as a local Department of Children and Families approved Narcan distributor. We do offer Narcan distribution for free, along with training on overdose response and reversal. All you have to do is call 386-77-PEER, and we will come out and train you on how to save a life through Narcan. So we are asking that we make Volusia County a friendly, recovery-friendly place to live. Please help us eliminate stigma, promote an understanding of substance use disorder as a chronic brain disease, and provide more recovery supports. Next slide. So this is a snapshot of VRA. Our two peers are out at the top. We have two peer staff that work for VRA, Jordan and Daryl, and they're available to provide recovery coaching and Narcan training and a variety of services. You just need to pick up the phone and call. In the center was a Narcan event that we did with training. To the right is one of our board members, Kathy, who is the chair of our Keeping Hope Overdose Awareness Day that's happening on August 28th at the Drive-In Christian Church in Daytona Beach Shores. And then on the other side is our Narcan chair and one of our board members who's a certified peer. And then on the bottom was a number of community members and VRA members that were at the first Keeping Hope event. Next slide. So what can you do? You can help us share that there is hope, there is freedom, there is recovery, there is a new way of life, one day at a time. And I had the privilege to meet Dr. Murthy, who is our current Surgeon General, when he was the Surgeon General in the Obama administration. And he made the statement at an event that I was at, that the best medicine of all is love and compassion. And I'm gonna wrap up with a story about my husband. My husband was a heroin addict for many, many years. And the last time he was in treatment, it was a local hospital, little hospital locally in the psych ward. And his family came in and they were like, oh, we're so sick of you. You know, you're hopeless, you're helpless. We're done with you. We don't want anything else to do with you. And they left. And one nurse came in and sat on the bed and looked my husband in the eye and said, surely there is something that you can think of to help yourself. You're not hopeless. You're not a piece of junk. You're a child of God. And he said, perhaps somebody from Narcotics Anonymous. And she said, I'll get somebody from that fellowship. And with that, she left. And by dinner time, a gentleman came in with a little piece of paper with some meetings on it. And he basically told my husband that he never had to use again, that he could go to these meetings and get help. And that was the last time my husband has ever used illicit drugs or alcohol. Today, he has 36 years of recovery, and he's helped thousands of people find recovery themselves. Next slide. So at this time, I'll take questions. I know I'm a little over, but it is the last session of the day, so I was assured we could run over. Thank you. And yes, you could get copies of the slides. Go ahead, Sharon.
Okay, now I can unmute myself. Thank you. It was good to hear you, Karen, and all of your personal, experience with this. The reason I joined this session was to find out about reducing stigma, because I was in a mental health meeting a couple of weeks ago. It was a weekend conference, and their focus was on reducing stigma. And it wasn't just about alcohol, drugs. It was also this conference was about cluttering. And so the reason I wanted to bring this up is because I know that you're with Volusia Recovery Alliance and RCOs. I'm with AACA. I'm with the 12-step side of it. And there is a program called CLA, which is Clutterers Anonymous. And, the point that I learned at this medical conference was that just like mental health issues of PTSD, bipolar, and that sort of thing, where now it's become, it's not a stigma anymore to, have to say those words, people realize people are getting help. I think that, I'm a little bit about the RCO versus the 12-step recovery, I think that we have to destigmatize alcoholism too, and it's not just substance abuse disorder, or I forget how you say it. I think that's how you say it. So I just wanted to mention that the stigma side of it is what really intrigues me, on how to destigmatize all of these so that we realize, like you said, it's a mental health issue also, and I guess, any take and input you have on that, and also to bring to light Clutterers Anonymous. I have friends who are involved with police or fire departments and EMTs, and they say clutter is a huge problem. When they go into some people that are having problems, it's a huge problem. So it is becoming something that is, and it's really a stigmatization problem there. Thank you.
So really, substance use disorder, addiction encompasses many, many different symptoms. The drug's a symptom of the disease. So the disease can manifest itself in many, many ways, such as, so I have a cluttering problem. If I'm moving and I want to shoot myself, really, because of all the stuff I have here. But, so alcohol is a drug, and it's a symptom of the disease as well. It's alcohol use disorder as well. It really encompasses, what the RCO, the work of the RCO is to encompass both alcohol and drugs. We're there to help support whatever pathway somebody wants. My particular pathway is 12-step as well. There's a question in the chat about support and how do we best help people that are affected by stigma. I think our stories have power, and putting a face and voice on recovery is important. Continuing to get the message out that recovery is even possible is critical to smashing stigma. Showing that people can get their lives back together. We have so many examples. You're one of them, Sherry. We have so many examples of people that have repaired their lives, that were, showing pictures of, this is what I looked like in active use. This is what I look like today. I was 89 pounds in 1982 when I got into recovery. And so when you look at what I looked like then and what I look like now, and the fact that I've been a productive member of society for 38 years, I think helps to smash the stigma. So the more stories we can get out there, the more compassion you can show people as healthcare professionals, just like the story that I told about my husband. That one nurse impacted his life for the rest of his life. And so we don't know the effect we have on people when we treat them with love and kindness. Just like Dr. Murthy said, it is the best medicine of all. So hopefully that answers the question. There is a RCO in Duval County called First Coast Recovery Advocates. They're up in Jacksonville. As far as other trainings, a lot of times SAMHSA is the SAMHSA website has a lot of trainings, as the Lutheran services in this area. Lutheran LSF Healthcare provides a lot of different trainings for healthcare professionals and beyond. So if you're looking for more trainings, I suggest that you go to the Lutheran LSF website. Other questions? Thank you.
It looks like you got them all, Karen. Great job. Thank you for that presentation. That was a very powerful one. A lot of people, it sounds like it affected them as well. So thank you for that. Looks like Kathy may have sent in a question just now. Learning about language when referring to addiction, substance use, or alcohol use disorder can be very supportive. So
yeah.
So yeah, I guess at this point, it looks like there was a SurveyMonkey link that you wanted to share as well.
Yes, please.
Okay.
So part of today's training is part of, we're involved with the OD2A project with the Department of Health. It stands for Overdose Data to Action. And it's a number of professionals and community members that come together to work on the overdose problems that we're having in Volusia County. And so if you would be so kind as to click on the survey and do the survey for this training so that we can use this training as a mechanism to achieve the grant that we have to do this work. It'll be very helpful. And I know the Department of Health of Volusia County will really appreciate the data.
So yeah, the link is, everyone should be able to find it in their chat now. So we'll give a few minutes to let people complete that survey as well before we end the session. Yes.
And to Sherry's point about the 12-step programs, you know, we embrace the 12-step programs along with other pathways, but you know, our efforts are never to put any pathway down or say that a pathway doesn't work, because for each individual, one pathway may work, but there's a lot of pathways that work and have a high success rate. So thank you, Sherry.
All right, so while I guess everyone is finishing up their survey, I'll do our outro, I guess, our exit statement. Thank you all for attending this session today. Yeah, I sent the link in the chat to a brief survey, and Karen would appreciate it if you would take a moment to complete it. When you are finished, you can navigate back to our event platform, HOVA, to explore our sponsors' profiles and our virtual exhibitor hall. We hope you enjoyed the 2021 Mental Health and Human Services Summit, and to have a great day. Thank you again, Karen. Great job.
Thank you. Thanks so much, everybody.
All right, everyone. Have a good one.